what is the impact of the ACA on the medical community and overall well-being of Mainers?
You know, the ACA is certainly not perfect. There's no way that there is any kind of federal healthcare reform that is going to be perfect. But I think it takes us in a great step in the right direction. I think what we have to realize is that the major goal of any health system is to make sure that we can all live longer and healthier lives. Our health system in the United States miserably fails on that. If you look at the United States versus other developed countries, we not only do not live as long and as healthy as people in other countries, but our healthcare costs more than twice as much than any other country. So we're paying a lot more than any other country for our healthcare, and we're not getting back it's not a good return on investment at all compared to what other countries get. I look at the ACA as having two major goals. One is insurance reform, and the other one is healthcare system reform. So the insurance reforms have to do with covering more people with health insurance. Every other country in the world that has good health outcomes also has universal coverage for healthcare. And yet the unique thing about this is that we're really retaining our employer-based health insurance system, which is also somewhat unique and I think provides some unique opportunities for employers and employees and health insurers to work together. In terms of healthcare system reforms, there are a number of reforms, for instance, payment reforms. What we know that really distinguishes our healthcare system versus many other countries' healthcare systems is, it's going to sound odd, but other countries with much better indicators than we have in terms of health outcomes and costs, they have a health-based healthcare system. And you might wonder, well, what is our healthcare system? Well, our healthcare system is actually more illness-based. So in other words, when do we encounter our healthcare system in the United States? It's mostly when we're ill. And the focus is on taking care of sick people, traditionally at least. In other countries, it's much more a health-focused system so that it really makes sure that you're healthy and you get to a healthier state and you stay there. Therefore, it's less costly and it has better health outcomes. So one of the things the ACA does is to help the healthcare system transform from an illness-based system to a health-based system, meaning that there's much more resources for prevention. Our healthcare providers are going to be expected to learn to provide preventive services much better than they have in the past. And there are monies for public health. There are payment reforms so that healthcare providers are paid to keep people well as when they're paid to treat them when they're sick.